Legionella is a bacteria found naturally in the environment. Bacteria grows in warm water and creates a biofilm on the surfaces surrounding that water. Hot, humid summers provide perfect growing conditions, while wind or a strong fan can blow contaminated water droplets into the air.
Breathing in mist contaminated with Legionella bacteria can cause a mild respiratory illness called Pontiac fever, or the more serious Legionnaire's disease, which is a severe form of pneumonia.
Epidemiologists in public health routinely monitor reports of infectious diseases to identify patterns and unusual trends. In late May of 2025, we noticed that the number of cases was higher than expected. That increase continued through June, and on July 8th, the medical officer of health declared an outbreak.
People exposed to Legionella may develop mild symptoms such as fever, headache, and muscle aches, and usually feel better within 2 to 5 days. Others develop more severe symptoms such as cough, shortness of breath, or confusion. These individuals may be hospitalized and tested to determine what caused their infection. If it is caused by the Legionella bacteria, then the healthcare provider must report the case to local public health.
As each case was reported, our colleagues in infectious disease began a detailed investigation. They asked questions like, where does the person work, where do they live, and where have they been in the 14 days before they became sick? That's where the epidemiologist and data health analyst comes in. We map the locations associated with each case and look for patterns and connections that might explain how people are getting sick. As more information came in, a clear cluster of cases began to emerge around a common area.
Public health inspectors took this map and, using aerial and satellite imagery, looked for potential sources of Legionella within a 6-kilometer radius. Bulk water samples and swabs of various water sources were collected. If samples indicated active bacteria, operators were directed to physically clean and chemically disinfect their equipment. Over the outbreak, 177 samples were collected, several of which were positive for Legionella bacteria.
The goal now was to identify the source of the outbreak by matching the exact DNA sequence from the hospitalized patients to the DNA sequence from the environmental sources. This DNA sequencing is done by growing the samples at the Ontario Public Health Laboratory.
In August, we finally found a match that indicated the source of the outbreak as a specific cooling tower. Further remediation of the site was directed, and finally we could declare the outbreak over for the final time later that year.
The 2025 Legionella outbreak was the largest in our organization's history. In total, 107 people became seriously ill, 97 were hospitalized, and 4 people died. Bringing the outbreak under control required an extraordinary interdisciplinary effort. Teams spent countless hours conducting case investigations, analyzing data, mapping exposures, and collecting environmental samples. To help others prepare for future outbreaks, the MLHU documented what we learned in a summary report and developed 26 recommendations. By sharing these lessons with public health units across Canada, we hope to help those who may find themselves in a similar situation.